everyone. Welcome to another episode of Know Your Calling Family. As you all know, we are amid the COVID pandemic and more recent breakouts such as monkeypox breakout. These incidences has helped us realize the prominence of microbiology in a medical setup. So today we have with us our dear Dr. Malabika Biswas, a passionate microbiologist, to talk about the branch. Welcome, ma'am.
Thank you. Thank you so much, Neha.
Talking about ma'am, she has done her MBBS at the West Bengal University of Health Sciences, followed by her MD in microbiology, in which she excelled, holding a gold medal from the Calcutta School of Tropical Medicine, India. Hi, ma'am. Hope you are well.
Yes, I am. Thank you.
Okay. Ma'am, there are so many breakouts happening currently. In this situation, as a microbiologist, what is expected out of you? We would like to start by asking you about the most recent situation.
Yeah, so I think you just answered yourself in the beginning of the video. So microbiology is such a dynamic subject. Okay. So until 3 years back, we didn't know about COVID. Until 2 months back, we didn't know about monkeypox. And going further back in time, about 35 years ago, we had no idea about AIDS. So the present pandemic, if anything, it has only served to tell us that a single microbe can change our entire world, right? So
Yes.
even 3 years back, we weren't aware about, that such a virus could change the entire landscape of the world. And, it would make us uncomfortable for the rest of our lives. Like we can't step out of our homes without wearing a mask. And now recently there's been another virus, another pandemic being declared a public health emergency, PHEIC. So that's monkeypox. So you see this subject, these infections, they just keep coming up. You don't know what to expect next. It's like someone is attacking you every year or every month, and you don't know what to do. So standing in this pandemic, or maybe when we have dealt with one pandemic, somewhat dealt with COVID, I don't know how much. It's when we have somewhat dealt with COVID, we're still getting new infections every day, and we don't know how to deal with them. So leave aside the pandemic. Let's take our own hospitals. Say one patient is getting admitted for, say, myocardial infarction, or say, let's take a more common example. Say he's getting admitted for an accident. Okay, and you treat the wound in everything, and a few days later he ends up with some sort of a wound infection. Okay, you don't know what to do, and you send it for a culture, and you end up recovering a very resistant bacteria. So this is what happens, that these organisms, we can't control them. Okay, we have no control over these organisms, because unlike other subjects in microbiology, we are dealing with things, with living organisms that are completely alien to us. Okay, we are dealing with things that are whose DNA and RNA is completely different than us. Okay, we have no knowledge about them. We don't know how to deal with them. And even when some bacteria residing in our body, the commensals, I mean, we don't know what to do with them. We don't know them. Okay, so that's why in today's scenario, at least, microbiology has emerged as such an important subject, and it's an ever evolving subject. It keeps on evolving. It's a very dynamic subject. Okay, like we have to read up every day. Like I have to read up some things even when I go home every day, even though I have passed, and it's like I am reading for my exams. So it's that a dynamic, that ever changing a subject. It's evolving every day. You don't know what to do next.
Okay, ma'am. So it's like if we are on a clinical side, we have to only read about the patient's aspect and all that. Now it's like you have to study the psychology of these bacteria and
Yeah.
things which you can't even see.
Yeah, that's very right. Psychology is so correct a term. And sometimes we would put up these biochemical tests, or try to diagnose them in a certain way, and we end up not recovering them at all, because we find that because we are recreating situations for them in the lab that we would find in our own bodies, and we still might not end up recovering them or isolating them from the normal samples, because something or the other has gone wrong. Okay, So we have to make sure that in order to isolate those bacteria or diagnosing whatever virus, we have to provide a similar environment or situation in our labs that makes them comfortable enough to come out to us and reveal themselves to us. Okay, so it's like,
Okay. Okay. Ma'am, could you expand more on microbiology as a branch? What are we dealing with so that we get a better idea about these things under microscopes?
yeah. So microbiology, it's divided into many branches, sub branches or subtopics nowadays. Um, so initially, when microbiology started out, it wasn't performed, or the earliest things in microbiology, they weren't done by doctors per se. So if you would know, I'm sure that all of you read something, some part of the history of microbiology in your MBBS. So you know that the earliest microbiologists, so to speak, they weren't, all of them weren't doctors, okay, or some of them were doctors. Only this wasn't a separate speciality per se, right? So some of them were chemists, some of them were scientists, and some of them weren't in any way related to science, to the sciences at all. Okay, so micro to become a medical specialty, it has faced a lot of challenges, it's still facing a lot of challenges, but it evolved on its own. Okay. So, today, where we stand as medical microbiologists, there's still a tag on it that it's a non-clinical subject, a tag which I somewhat resent, because anything you do after passing MBBS, any specialty that you take up after passing MBBS, that's hardly anything non-clinical. Because today, if I end up giving a wrong report to a patient, I could lose my license. So it's in no way a non-clinical subject, because every report that you give out to the patient that deals with the treatment of the patient and influences the decision makers out there, the clinicians, so to speak. So that's why it's extremely important. And coming to the sub branches of microbiology, there's bacteriology, where you deal with bacteria, the antimicrobial resistance in the bacteria, which has recently emerged as such an important topic of interest. Then, of course, you have virology. So I don't think virology needs any introduction. What after COVID and it's done to our world. So that, and virology also needs you to collaborate with molecular biology. The molecular biology labs is what saved so many people in the pandemic. So that's virology. Then you have parasitology, where again you have two different divisions. You have helminthology, where you are dealing with a lot of stool parasites, and you have protozoology, where you are dealing with malaria, one of the most basic examples. And you have mycology, of course, where you're dealing with so much fungus. So mycology also has been brought to the fore thanks to the efforts of Professor Arunalok Chakraborty, who is an internationally renowned figure in our country. Okay. And of course, you have clinical immunology as well, which is so very important to diagnose so many of our microbiological infections, or so many of our infections. Because you see, you can't isolate or diagnose every organism on a culture plate and under the microscope. So we need to adopt some indirect methods in order to diagnose them. So that's where immunology comes in. So immunology is also an extremely important part in microbiology nowadays. So that's in brief about all the branches in microbiology. And of course, there is infection control, there's antimicrobial stewardship. So the list just keeps going on, and it keeps on expanding. I mean, maybe tomorrow we will get an algae, which is also a microorganism, which if it becomes infectious, maybe we would have, algae as a different branch. I don't know. Like, these
Okay.
things just keep on coming.
Okay. So thank you for explaining to us all that comes under the umbrella of microbiology. Now, ma'am, how's the life in this branch? Like during PG, post PG, what is expected that we do once we join this branch?
Okay. So one thing I would like to clarify before coming to that, going into that topic is during MBBS we hardly get any exposure to microbiology, right? Or all the laboratory-oriented subjects that we have, even radiology, which is which is the topmost choice of all the toppers. So we need to get over a few things after before one chooses to step into microbiology, that this isn't a conventional subject. Okay, no lab oriented subject is, but especially microbiology. So when you step into PG, you won't be doing all the things that you have spent doing in internship. Okay, so when you step into a lab, the first day of your residency, microbiology residency, you're expected to do a gram stain. That's a very basic procedure that we were taught during MBBS. But we took so much time performing only 1 gram stain or 2 gram stain during our MBBS days, and that too after a lot of challenges. Like I remember, I used to spend a lot of time cleaning my slides during my MBBS, and I used to have a tough time focusing the microscope when I was back during my MBBS days. But when I stepped into like my residency, I saw that that for 1 month, that's all I did, the gram staining, until I could do it in my sleep. So that's what I was expected to do during my initial days during the residency, which is completely different than anything that I have been trained during my clinical years in the final MBBS and internship, talking to the patients and everything. So that's what you have to remember during your PGship in microbiology, that this is a very unconventional subject that requires you to become a good bench worker. That all these things that we do in the lab, microscopy and staining and putting up the biochemicals and everything, that's known as bench work. Okay. So bench working is akin to what a clinical, so-called clinical PGT would be doing in the wards. Okay, like channeling and all. So that amount of dedication you need to learn all these bench work. Okay, and it might seem very mundane at first to a person who is not oriented. Okay, so you need to be understanding that that even though this is not conventionally what we would expect of a doctor, all this is going to make a report, all these efforts are going into developing a report that is ultimately going to make your patient better. Okay.
Okay.
So that is what that is in brief about what the residency is all about. I will tell you personally about my residency in order for people to get a better idea.
Sure.
So I was very lucky to do my PGship in an institute that had all the labs and all the separate branches of microbiology being catered. Okay. So you started out the bacteriology lab, then they post you in virology and mycology and helminthology and protozoology. So we were very lucky in our institute that we got well-developed labs in all the sub-branches of specialities of microbiology. Okay, so we got a very good idea of what to be expected in this subject. So just like we got exposure in the bench work in bacteriology, we also got exposure in virology in the molecular biology labs, in mycology, where we, there's a process called teasing, where you have to tease the fungal growth molds like aspergillus to see what the morphology is. Then we got posted in malaria OPD, where we got to see a lot of malaria patients, give them drugs. Then uniquely in our institute, we have a helminthology clinic, we have a filariasis clinic. Okay, so one of the fewest, I think, filaria, exclusively dealing to filaria patients in the helminthology lab. So like this, we got to rotate through all the subspecialties of microbiology and get a good idea that what is the holistic picture in this subject. Okay. So that's what I would advise my juniors as well, that choose an institute which gives you a clearer picture of like what to do, and get into an institute which has good labs. Okay, it's good lab work, learning good lab work, even though it might seem mundane to you because of your background and training as a doctor, as a clinical doctor. It's extremely important. Okay, and you get over this mindset that that I've been trained to do clinical work. So I'm not seeing patients on a daily basis, and therefore, this is uninteresting or mundane. So one has to get over that mindset at first, that this is what I'll be doing and this is what I'll be learning, and this is ultimately going to make my patients better. Okay, I'm contributing to a very important part that is going to make my patient better. So
Okay,
that's
ma'am.
like a picture. Yeah.
Ma'am, I love the way how you told us a different perspective, that it is not a non-clinical subject, how related to clinics it is. So when we all say we want to be doctors, the first thing we picturize is a doctor-patient
Yeah,
interaction. But that
definitely.
is missing in this subject.
Yeah.
Only when you're handing the report, or only if you're seeing the presenting complaints, only that is the interaction. So how did you prepare yourself? Like you said, it will look mundane to you, that this is what we are doing. It is different from what we did in residency. So how did you prepare yourself to do all these bench works? And in short, what is the personality type we should have to pick this subject?
Okay. So for me personally, I did not have much qualms with doing the bench work, or getting over the mindset per se. But I wouldn't say that there is a zero interaction between the patients, because in many institutes, like the central institutes, so to speak, they have compulsory clinical rounds. Okay, so there's a microbiologist who accompanies the clinicians every day and sees the patients, and then they decide upon the final diagnosis of the patient, and do tests, or make the antibiogram accordingly. Okay, so every morning in our bacteriology lab, we have this culture sensitivity reporting, where each report is curtailed or customized according to the need of the patient, right? So I'll give you an example. For example, if we isolate Proteus, Proteus is a bacteria, right? So if we isolate Proteus from a patient, we find that the bacteria is resistant to nitrofurantoin, a very important antibiotic that is given in urinary tract infections. Okay, but let me tell you that Proteus is intrinsically resistant to nitrofurantoin, like it's naturally resistant to nitrofurantoin. It has this natural undeveloped mechanisms where it cannot act like it is not susceptible to nitrofurantoin. Okay, so
Okay.
unless you have this knowledge as a microbiologist, you cannot directly act. So I've seen a lot of clinicians who erroneously give nitrofurantoin in spite of seeing a Proteus in the report. So they might not know it. It's fine. Like you might not know the nature of the bacteria and all the organisms per se. So it's very important for us as clinical microbiologists to tell them that this bacteria is behaving in a certain way. So that's why you can't give this antibiotic to that patient. Okay,
Okay.
this is where the role of the clinical microbiologist comes in, where you're acting as a bridge between the hardcore clinicians, and your medical technologists, or your PhDs, or your biomedical scientists, who also play a very important role in microbiology. So you are the bridge between the two worlds. So when you realize this, that you are a bridge, and you know that you are acting as a facilitator for these two worlds, it is then that you realize your importance inside the laboratory, and you overcome this feeling that whatever I'm doing in the lab, that is just restricted to my bench work and won't contribute to the patient. Okay, so
Okay,
this
ma'am.
is one way that I prepared myself. Yeah.
So from the microscopic view, we have to get to the huge picture. Only then we feel interested in it. That's what you're saying, huh?
Yeah. So
Okay, ma'am.
you need to expand your minds. Okay, so this is actually, microbiology is a subject where you need to have a very childlike curiosity about this subject. Okay, so you need to go back to your basic sciences in school, and your love for microscopy, and you need to be a little nerdy to be in this subject. So I was a little bit of the nerd type. I still enjoy my watching my science fiction shows and my Stranger Things. So I was always a little nerdy, and I've found that people who excel in this subject, they are a little nerdy. they are a little bit atypical, I would say. They are not like the clinicians, or they're not very conventional, so to speak. I mean, there's nothing wrong with that, but they are a little nerdy. Okay, so you need
After
to
all, you
if you
guys are like Sherlock Holmes with a microscope. So,
yeah, so a bit like that. Like, I wouldn't say that as brilliant as Sherlock Holmes all the time, but you need to have a bit of a questioning mentality. You need to be curious. You need to interrogate yourselves, that how much more can I learn. Okay, so during the initial years of microbiology, during your first years, this is what is going to keep you going. This realization that how I am helping the patients in a larger picture, or how much I need to know about this subject, because we hardly have any exposure to this subject in our MBBS days. Okay, so this hunger for knowledge is what keeps you going. It's a slow process. It's not overnight. You won't see like five bacteria, or and that's microbiology. No, it's a huge subject, and you have to keep realizing that you need to study more, need to learn more, see more cases, see, correlate clinically. This is what we keep writing in our reports. Please correlate clinically. So actually, it's more a note to ourselves than to the clinician. Like, of course the clinician has to correlate, but it's more a note to ourselves that we should be the ones going to the wards and correlating clinically, in order to generate quality reports.
okay. Ma'am, coming to life in general, so do you have time for yourselves, or do you have any side hobbies? If you go into this branch, will you have time for all that and time for family? How are the things in that
Yeah,
aspect?
yeah, that's a very interesting question. So I think it depends upon you. What are your priorities? Okay, so micro, funnily, okay, it has a lot of women. It's a branch that is very female dominated, in contrast to orthopedics, maybe, that is so male dominated. Okay, so there's nothing wrong about that, but just to dispel a misconception, there you shouldn't take, or I think a lot of girls, women are encouraged to take up microbiology just so that they can give time to their families, or they can, I mean, there's nothing wrong with marrying, and I mean, of course, but you should realize that micro demands the same amount of dedication and love, and time, and after hours, that a clinical subject does, and it's only then that your subject or you get to excel. Okay, speaking in general, no, of course, time wise, it's not as demanding as medicine or surgery. I mean, that would be a very unfair comparison if I say that I give the same amount of time to my daily work as do the clinicians, or any surgical or medical medicine resident or doctor. But yes, it depends upon you. I have seen certain seniors who have spent a lot of time overnight in the COVID, working in the COVID pandemics, or when we did a lot of stuff in the labs after hours, after say 6 o'clock, 7 o'clock. So no, per se, it wouldn't require 24-hour shifts like that. But as I told you earlier, that it depends upon you, it depends upon your mindset. If you want to learn more, if you want to give more time to researching, then of course it would take up a lot of your time. If you are someone who loves spending time in the laboratory, or wants to go the extra mile to learn that subject, then maybe he or she would like spending extra hours in the lab. But per se, no, it in general, if someone wants to go after, say, the general hours, he or she can go home and spend time with their family. So it depends upon institute to institute, but no, it's not a hectic subject per se.
Oh, okay, ma'am. Ma'am, how about your timetable? Like every day, do you have lab work, or is there something else that's happening in the department? How is it?
Yeah, so microbiology, now, as a resident, your life is divided into multiple parts. Okay, you have lab work, you have the various labs going on in your institute. You have a lot of documentation work, okay, a lot of clerical work, which again a lot of people might find mundane, but which is absolutely essential to maintaining the quality of your laboratory services. Okay, You
Yes.
can't ensure good or proper laboratory work if you don't maintain a proper documentation of the reports that you are giving out. Okay. So
Okay.
clerical work or proper documentation, you have to be as good or do as good clerical and secretarial work as as any big multinational office that so you have to be that good a manager, that good in management and keeping your books, keeping your records correctly. So besides laboratory work, that is a one very important aspect. Seeing that the work goes smoothly day to day, that is also extremely important. Okay. And of course then there's liaison with the clinical people. Okay, you have to communicate your reports to them. You have to ensure that they get a correct report. Like I will give you an example. Sometimes we isolate a bacteria called coagulous negative staphylococcus in blood. You might have come across it in your reports when you work in the wards. So that's more often than not, it's not a pathogen. It's a skin commensal that has somehow entered from the skin into your bloodstream while the person is collecting blood. So you need to put your clinical acumen to use, and you need to judge whether this report should be going out on or not. Okay. So like the other day we had one coagulous negative staph or and a pseudomonas in a wound sample, and we had to judge whether that bacteria itself was responsible for the infection or not. Okay. So
Okay.
this, as a clinical microbiologist, this is where your judgment comes in, that whether if I have isolated a bacteria, or if suppose I have if I get a positive reaction in a serological report, should I give it, or is this even relevant? Okay. So that judgment as a doctor, as a clinical microbiologist, you need to do every day. That is where your role comes in. Otherwise there are a lot of laboratories being run by non-doctors, or by non like not even microbiologists per se, who end up signing reports that are not correct. Like, okay, so you might end up giving cephalosporin as a drug in the antibiogram of an enterococcus report, and that drug is not even relevant in that bacteria. Okay. So that
Okay.
relevance of reports in your day-to-day life, to judge that, you need a clinical microbiologist. Okay. So that
Okay.
is our daily life in general.
Okay, thank you, ma'am. Ma'am, now this subject is a research-based branch, right? So, in that aspect, from MBBS time itself, were you so much into research, or should there be a natural inclination towards research, or after we join PG, can we develop that kind of interest? What do you think about that, ma'am? Only if we have this interest, should we go, or can we naturally learn it as time goes by?
So yeah, I think there's always an element of research involved for any branch you take up. Okay. So in PG, you have a compulsory thesis that's to encourage research work, and focus on an in-depth learning of your subject. So that's for any doctor of medicine that degree, any MD degree, that you have to have a little bit of an academic or research mindset. So, coming to me, yes, I was a little bit, as I said, I was a little bit nerdy from my MBBS days. So, yeah, I did have this inclination for research. In fact, my one of my main reasons to join this subject was research, and then I gravitated more towards the clinical side. Okay. So, yeah, research is a very important aspect of this subject. And as I told you earlier, that you have to think like a scientist when you step into microbiology. Okay. So you need the thought process of a scientist, and the skills of good medical technologist, and the judgment of a clinical PGT, and the acumen of corporate manager, to be able to do well in this subject. Okay. So
Okay.
yeah, that is that you if you are teachable as a person, then I would say, yeah, of course you can go and learn. I mean, there is hardly anything about research that I knew before stepping into my MD degree. And not just for microbiology, for any subject, if you take up PG, then you have to have a little bit of an academic or research mindset, at least, to go through with the entire process of completing your thesis, and to get a better in-depth knowledge of your subject. Okay. So the more research papers that you read, and the more you educate yourself, the more of CMEs that you attend properly, not just to eat or take the bags and stuff. But if you properly attend a CME, then there's a lot to learn that you can put to daily use. Like I was doing some research on typhoid, like some days back, and I realized that many people in our country, they don't get proper reports, blood culture reports on time, which is the reason why clinicians are not able to administer proper
Mhm.
antibiotics for typhoid fever, and this has ended up generating a huge influx of drug resistant salmonella. Okay,
Oh,
so this is an example where my research or my habit of reading the papers has taught me that this is what is happening. Okay, so it's
oh,
very important to keep up with new research and to learn research. Of course, micro is a subject where you get to collaborate and work with a lot of biomedical scientists. So this is another point that I would like to focus on. I have seen people coming into my subject and sort of low-key resenting the non-medical people. Okay,
mhm.
like resenting, like why do I have to speak so much to the medical technologists, or why do I have to answer that molecular biologist, or why do I have to speak with a biomedical scientist? They are not doctors. So you need to get over this, one needs to get over this high chair, get down this high chair, that just because I'm a doctor, I shouldn't talk to this person who doesn't have a MBBS degree. So that's a very wrong mindset. You need to be able to teachable, and you need to be able to collaborate with a lot of people who don't have an MBBS degree. You need to collaborate with veterinarians. Okay, so that's a very up and coming field, veterinary microbiology. It's a very up and coming field. If you would know about the concept of One Health, I don't know how much of that you are made aware during MBBS, but One Health is a concept that is coming up nowadays, where one needs to be aware that all this drug resistance and all these diseases, that is not the cause of a single that is not the fault of a single person, but rather multiple reasons are linked. Like we have these chickens, and they feed on food that is derived from the soil, which is rich in drugs like pesticides, and they are fed with some antibiotics, which have contributed into creating superbugs. So this is one knowledge that we gather only by communicating with veterinarians or agriculturists. Okay, so
Okay.
if you were to excel in your field and really get to a depth of it, then you need to be able to collaborate with a lot of people, okay, who might not hold an MBBS degree, but who have in-depth knowledge about the behavior of the organisms and newer diagnostic modalities. You need to communicate with people in the the machine companies. Okay, like there's a very good biomedical company called Biomeru and Becton Dickinson, who develop these really cool machines and the antibiotic disc. So you need to communicate with them in order to get a larger picture of the subject, and this only happens when you have a little bit of a research and academic mindset. Okay, that hunger should of knowledge should be there, that no matter what the situation, what the person, I should be able to learn from that person. Okay.
Oh, okay, ma'am. Thank you for that, ma'am. Ma'am, all these serious things apart, you're looking at the microscope almost for three by fourth of your work time, right? So is
Yeah.
it stressful, like the eye strain and all that, or do you get used to it over time?
No, I actually like seeing the microscope a lot. Okay. So no, it's not like that. Yeah, like for a huge number of samples, of course, it's strenuous for the eyes. But once you keep looking up the microscope, your eyes sort of adapt. Okay. So even I don't wear spectacles, but people with spectacles, they sort of develop their own, power. का कुछ adjustment होता है, so they adjust themselves to the microscope. Okay, it's not fatiguing, although I would say that I got a really bad back pain a few days back, which might have been because of me peering down my microscope. But it's very interesting. You don't feel like you have passed a lot of time peering down your microscope, because there are stories inside the microscope, patient samples that are being stained, and stories waiting to be told to you through that microscope. There's a little world out there, a little alien world out there. So no, you get used to it. I don't think the people, even the people who find the bench work mundane, they sort of like the microscope. And it's like I have seen all of my residents, my first year PGTs, getting to get the hang of the microscope within like 2-3 days. So it's not
Okay.
that tiresome. Yeah.
Ma'am, there is this thing they say from our microbiology department that once you enter this department, you wouldn't feel like touching anything in public or any lift switch or the railings. Otherwise, you would be dragging your fingers on it. So, has it influenced you like that in life,
Uh,
wherein you're very
it
strict
has
and
given me. It hasn't given me OCD. Of course, the pandemic as a whole that gave me OCD because I would be coming back to home to my aged parents, and I was always anxious of transmitting the virus to them. But yes, a bit of it, like a few years back when we were just foraying into this yeast. There's this yeast called Candida auris. Okay, there's this fungus. It's in yeast like, more specifically. If you have heard of Candida auris, it's a super bug. It's a very drug resistant fungus, and we isolated this Candida auris in one of our samples, and me and my senior, we decided to get take swabs from the patients. This is actually an ICMR guideline where you have to take surveillance swabs from the patient in if there's Candida auris, which is it's a very resistant bug. It's worse than many multi-resistant bacteria. So we went to the patient and we collected the swabs, and we were very, and this was the pre-pandemic era, mind you, when people weren't that sensitized about masks and PPEs and using proper gloves even. So we just went in and we took the swabs, and we are very confident that we have been colonized by that fungus. We are very, in fact, I work, like part of my work every day is to do isolate some bacteria and preserve bacteria for national antimicrobial resistance containment program. That's a national program like NACO or NTP. Okay. So I am very confident that I have developed a colonization in my body from all these bacteria, and the moment I become a little immunocompromised, I'm going to die because I am constantly exposed to them. So it hasn't given me OCD as such, and I haven't seen my seniors, juniors, or batchmate developing OCDs. But yeah, like you need to be sensitized about maintaining proper hand hygiene. I have seen one or two lab mates fall ill after handling a culture of salmonella. Okay, and mysteriously that one of my batchmates, he developed typhoid 1 week after isolating a salmonella, and we still think that it was because of that particular specimen. So yeah, like I wouldn't say that it gives you OCD, but you better have a little bit of OCD. Okay, you better have a little bit of OCD. That sense of sanitization and that sense of you maintaining proper hand hygiene is extremely important to do our daily work. Okay, otherwise we
and
won't.
the colleges here they do provide enough safety materials or measures, right, for all
Yeah.
this.
Yeah,
Okay.
definitely they do. Actually, most labs, most well-developed labs, what after the pandemic, have safety hoods and biosafety cabinets. Okay, so we are encouraged to do all our work inside the biosafety cabinet. Although this is more to preserve the quality of the culture that you are doing than for yourself. It's sort of like surgery where you wear all your gear to protect the patient. So here, isolating quality bacteria, a proper pure quality of the bacteria without contaminating it with bacteria from your own body, because our body is made up of trillions of bacteria. So I might end up isolating something in my culture from my own body and end up thinking it was actually from the patient's body. Okay, so that is very important. So all the safety measures that they give you is more for providing quality work than for you. But of course that helps us too. I mean, the biosafety is like, if you are dealing with doing all this work for COVID, extracting RNA, and those have different biosafety measures and protocols. And if you are suppose dealing with a very harmful bacteria, for example, like brucella. Brucella is something that can spread by aerosols, and laboratory acquired incidents have happened, are recorded. So for all this bacteria that are like, there are, if you study like bacteriology and these chapters in depth, then you see there are separate chapters dedicated in our books that are for laboratory acquired infections. Okay, and there are various risk groups of those pathogens. Okay, so all the bacteria, they don't have the same risk. Okay, one bacteria, like if I inhale Ebola, I might die, but if I sort of end up touching E. coli, similar sounding, notice, but you are not going to die. You might get a bad infection if you consume it, but you're not going to die. But of course, if I inhale Ebola, I'm going to die. Okay, so
Okay.
this is the thing, that there are various risk groups that have divided the organisms into various, like 4 risk groups are there. WHO, CDC has done these things, and this is for the good of the laboratory workers or people who are sitting inside the lab. So of course there are measures, people have given a lot of thought, they have experimented a lot, they have there are various guidelines that cater to the occupational safety of the laboratory workers. So if one comes in, don't worry, we are not going to expose you to Ebola or any organism that I find is unsafe or hazardous. I will look after the safety of my staff, and like you automatically have to you adopt different safety measures for different organisms. That is
I think
paramount.
this will make all the audience safe. Phew, we are not going to die in the lab like that.
No, no.
Okay. Ma'am, earlier you explained to us the various divisions available in microbiology. Now, are there super specialties available for each branch? And is it available in India?
So, microbiological super specialties, I would say, presently in India or anywhere else in the world, for say, um, they are not available as super specialty degrees like that. So, there is a DM virology course in CMC Vellore and in NIV Pune, National Institute of Virology, Pune. So, virology as a super specialty degree is available, although the seats are very few and very far. Okay,
Okay.
so there are like 1 or 2 seats hardly. Then there's a DM infectious diseases. That's that also they have restricted number of seats. That course is available for not just for like not for microbiologists only. That is applicable for MD medicine and MD tropical medicine people as well. So that is not exclusively available to microbiologists. But the other branches of microbiology, like mycology or bacteriology or parasitology, those are, though a lot of work has been done, a lot of academic work has been done in those subjects, but they are not available as super specialty courses
Okay.
still now. Maybe in the future, maybe in the next 10 years, fellowships are available in
Well,
infection control, antimicrobial stewardship. Various fellowships are there, because what happens in our MD course is that the initial few years you are doing mainly bench work. You are learning to isolate the organisms and identify the organisms, and concentrate on preparing a good report. But our present design of the course is such that it doesn't give much scope for training and rounds in the world. Okay, so that is one scope of improvement that is there in our Indian MD microbiology syllabus, but that is also coming up. That's why there are fellowships available which take in microbiologists so as to train them to correlate these things better, to see the patients and develop a judgment on your own, ki what tests to order and which tests are relevant. So that is there.
oh, okay, ma'am. Ma'am, now with the advent of AlphaFold, open sourcing, etc., how do you think the branch will evolve alongside with artificial intelligence technology, like the growth of branch? Can you tell about that, ma'am?
Yeah, so that's a very good question. I think artificial intelligence is something that we are using everywhere, from Netflix to Tinder to everywhere. I think artificial intelligence is the need of the hour, sort of. So yeah, I think using these software, these artificial intelligence things is it's very important, but maybe just maybe all these high-end robotics and artificial intelligence, they were set to take over the medicine as speciality in the future. Like I read a book a few years back. The book was called Final Diagnosis, and there was this certain dialogue between an orthopedics doctor who was saying that one day robots might take over us. So artificial intelligence, if it's well developed, it might take over our jobs eventually, but we would still require doctors and bench workers and people practicing the subject per se. So I'll give you an example. There is this machine in our lab, very important machine, Vitec. Okay, so Vitec, we use Vitec to identify and generate our antimicrobial susceptibility reports. Like we can do it manually as well, but Vitec gives a better turnaround time. The turnaround time is the time taken for you to send your sample to the lab and for us to generate our reports and eventually send it on our way. So of course, using an automation is going to generate better reports. So Vitec uses some component of artificial intelligence where it takes all past records and analyzes the isolate that you have prepared and fed inside the machine in order to arrive at the perfect the result. But that result is not always the perfect result. For example, I gave the example of Proteus. So the Vitec would show that nitrofurantoin is resistant in Proteus, but it has to be you who has to make this judgment as a microbiologist or as a clinician whether I should report this antibiotic to that patient. Okay, so that is where your role as a human being comes over the machine. Okay, so at the end of the day, I think yes, artificial intelligence very good. It would help us in documenting and making our patients' lives easier, our lives easier. But at the end of the day, it has to be your human nature and your empathy that would get a good report on its way.
Okay, ma'am. Ma'am, coming to settlement, in this branch, how much time would we take to settle in terms of monetary aspects or the time? Can you elaborate on that?
Okay. So first of all, if this isn't a branch where you could make bucket loads of money. Okay, but this would differ person to person and the kind of job that you would take up. If one were to foray into academics exclusively, like take up a job as a medical teacher in a college, then of course in the government services, then of course that's a secure job. It gives you the opportunity to teach your students, make them aware about the beauty of this subject, as well as doing a lot of bench work and doing what you think is good for your department, everything that you, because these in microbiology we don't just teach, we also have to do a lot of lab work and a lot of hospital work, right? So that's a good option, and that is a secure job, even though you might not make as much money as your peers in other clinical subjects. Okay. Why? Because they have the option of doing multiple practices, setting up their own practice, whereas in micro you don't have this option. Patients won't come to you to ask ki mera report ka kya hua hai and what to do, even though that is something that if we do good patient communication, maybe there would be a time where report interpretation is a separate subspecialty in this subject. Okay, because laymen, they don't understand the value or how to interpret the reports, and we have a very educationally inclined India nowadays, and just like in the foreign countries, they won't leave unless they have realize the meaning of the reports. Okay, they won't take your word keyword, they will want to go to the depth of the interpretation of the report. Okay, so that is their government services, the secure government jobs with all the perks is of course one option. Also there are corporate sector jobs. Okay, of course they pay you well, but in comparison to other clinical specialties, again there are fewer seats or fewer jobs available. Okay, so you won't need 50 or 60 doctors for microbiology in a single department. Usually that's one or two, but I am sure that as the subject evolves and there's more demand, there would be more supply of microbiology, so more jobs would be created. And of course our pandemic has created a lot of jobs on its own. Okay, so nowadays any new lab that opens up, they will want a microbiologist. It's not possible for a new laboratory, a standalone laboratory, however new, to open up without a microbiologist, because without a micro person, you cannot generate good quality reports. And as I told you, nowadays patients get to the depth of the report and they want good quality reports. Okay, so this maybe wasn't the scenario even 10 to 15 years back, but now maybe because of COVID, because of all this um, exposure to the common person about infections, they are very sensitive about the kind of report that they are getting. Okay, so the other day I had a patient in our lab, and we do these tests for syphilis, and that person wanted to know whether this was a treponemal test or a non-treponemal test. And that's absolutely extraordinary amount of knowledge for a so-called lay person, okay, an educated person, but who is a lay person to this subject. So that's the amount of knowledge and awareness that people have about about medical specialties and the subject and infections. They're very much well educated. So any lab you go to, they will want a good report. Okay,
Okay.
so new jobs are coming up. Coming to settlement, as such, as I told you earlier, if you take up a government job, for that matter, any subject, any branch, government job is always more secure, right? It doesn't
Yes.
come with the anxiety of losing your job and setting up your own practice and like that. So this varies from person to person. It depends upon your skill, how much you're able to communicate, how much you're able to go out there and do your thing. It depends upon that. Okay, so and upon the kind of city, or whether you're living in a city or a periphery, depends upon that. In peripheries, nowadays, new labs are coming up which need more microbiologists. So any person who goes to a periphery, they might have some initial problems setting up a lab and providing reports. But once people realize the importance of good reporting and the importance of quick report for an infection, they will come to know about your importance and they will give you more job, more work, and that's all, of course, going to translate into more income for you. Okay,
Okay,
so
ma'am.
that.
Ma'am, now that we are moving towards the end of it, would you like to summarize the advantages and disadvantages of being in the branch?
So advantages and disadvantages, that would purely depend on your perspective of the subject when you enter, on your optimism. As I told you, that we need to get over this mindset that this is a non-clinical subject and I am sort of staying in the shadow, only doing mundane lab work, doing documentation. I'm not seeing the patient. So this mindset, if you can overcome, then automatically that becomes an advantage for you. Okay, so everything that you are taught during your PG ship in microbiology, as I told you, it's completely different from what we have learned or been trained as doctors, as conventional doctors. So if one gets used to the mentality that this is how I'm helping the patient, I'm using different components of my training, my clinical judgment, in order to arrive at a good diagnosis, at the end of the day, that is helping my clinician to give better antibiotics or do better for the patient. So that is one part, that automatically every disadvantages and every cons that you think in this subject, that becomes a pro at the end of the day. Okay, and coming to the monetary aspects, of course, if one wants to take up a branch that is more lucrative and it provides you, a better job market, then of course that is one thing that you have to be able to adjust and adapt yourself like that to the subject, that I might make somewhat less than my clinical peers, but I'm getting 100% job satisfaction. Okay, so that is
Okay.
what we have to think.
Okay. Thank you, ma'am. Now, is there anything else you would like to add, ma'am, before we wrap up?
Don't take up clinical micro for the sake of it, or because you have been taught by a lot of peers that you should take up this subject only to spend time with your family. No, when you come into this subject, you should be able to spend as much dedication, with as much love and care that you would give to any other subject, any other so-called clinical specialty, and it is only then when you excel in this subject. Okay, So this is all I
Okay.
would like to say to my young
Thank you
friends.
for the special message, ma'am. It was so fun having an interview with you, and you explained in great detail. Thank you for spending so much of your important time with us. The KYC team is very grateful to you, and I'm very sure the audience will find this interview very useful. I'm
I
pretty
hope
sure
so.
they have a clear cut idea on what they are supposed to do as a microbiologist and all that. And I hope a lot of them come take up
Yeah,
microbiology.
and what I somewhat low key missed was infection prevention and control. That is a very important and upcoming branch. Any microbiologist in any good corporate hospital, even in the government sector, they are coming up with separate roles for infection IPC people. But infection prevention and control and antimicrobial stewardship is a very important branch, and that's a special subspecialty on its own. And any hospital corporate setup you join, they would require you to function as both the consultant microbiologist and the infection prevention and control officer. Okay, so this
Oh,
is another very important aspect.
okay, okay. Thank you, ma'am. So you have explained the advantages, disadvantage, how our life will be, what we are supposed to do in the lab, how to choose a college, and what the branch is about research, how you can learn it, how you should be learnable, and the little bit of nerdiness we require in the branch.
Yeah, you do.
It was a pleasure talking to you, and I hope you have a great day, ma'am.
Thank you so much, Neha. It was
Thank
wonderful talking to you.
Okay, ma'am. We'll see you later. Thank you, ma'am.
Thank you.